I've worked in the emergency department and in the hospital setting for over 20 years. I would say that over half of the ER visits that I've treated are in some way related to being overweight. This would include heart attacks, strokes, blood pressure issues, back pain, musculoskeletal pain, arthritis. So many of these things can be related to being overweight. Why would somebody want to take a medication to help them lose weight? For many people, self-discipline and increasing their physical activity just won't get them there. If you're a person who has attempted to lose weight multiple times and you just can't get that weight off, using a medication to help you lose weight under the guidance of a physician may be a great option. Semaglutide belongs to a class of medications known as glucagon-like peptide 1 receptor agonist. Basically, after your body eats and you're full, a type of peptide is released by your body to help you feel full and break down stored energy in the form of fat and glycogen. These medications literally take away your appetite. Semaglutide and other medications like semaglutide have been around for decades. They've been proven to be safe if used under the guidance of a physician with regular lab testing. Multiple clinical studies have shown the average person will lose up to 15% of their body fat within about a year, with the majority of the body fat being lost the first 3 months. With all the medical costs associated with being overweight, the real question is why not? Schedule a free discovery call and see if these medications may be a great option for you.